Hello everyone, I'm Kate Bayansi Icona, and today I'm going to perform obtaining the vital signs. Accurate measurement of vital signs is critical because it reflects the body basic functioning. It serves as a baseline data which allows us to track changes in patient's condition, recognize an early patient deterioration, and prevent harm and error that may occur. Vital signs include temperature, pulse rate, respiration rate, and blood pressure. The paraphernalia needed are the digital auxiliary. This is used for patient body temperature, a stethoscope, and sphygmometer to measure patient's blood pressure, and watch with a sweep second hand to measure the patient pulse rate and respiration rate. Alcohol for disinfection and to avoid contamination. Assessing the temperature. So now I'm going to start by taking my patient's body temperature. The temperature is very important because it reflects the balance between the heat produced and heat loss of the body. And there are few sites which we can obtain its measurements from. It could be through oral, temporal, rectal, auxiliary, through the tympanic membrane. But for me, I'm going to get my patient temperature through oral and auxiliary sites. Prior to conduct this procedure, first, I am going to close the door to ensure my patient's privacy. Then, I'm going to adjust the light, the room, the temperature, and the position of my patient for the client's comfort. And of course, we must perform hand hygiene before doing this procedure. This is to disinfect and avoid contamination. Now, I'm going to introduce myself to the client and verify her identity and using agency protocol, and explain the procedure to her and how she can participate during the assessment. This done to avoid misunderstanding and to get clients' trust in order to get the assessment done successfully. So good afternoon, ma'am. I'm Kate Bayansi Icona, your student nurse for today. So ma'am, can I see your response? So please state your name and your birthday.
My name is Mia Monica Peralta and my birthday is on June 15, 2003.
Okay, so thank you so much, ma'am. So now I'm going to take your body temperature. I'm going to put a digital thermometer in your mouth so I'm able to take your temperature. Is that okay with you, ma'am?
Yes.
So since I'm going to use the digital thermometer, I'm going to disinfect it first by wiping the tip of the thermometer within a alcohol in the firm twisting motion. Then I'm going to place it on the posterior sublingual pockets with my patient's mouth. So, ma'am. Okay, close. Thank you. So now we're going to wait until the thermometer beeps. This is because when the thermometer beeps, it indicates that it's already obtained the patient's temperature. So after that, of course, I'm going to inform my patient about the result and disinfect the thermometer and document the data that I've got. Okay, ma'am, your temperature is 36.9 degrees Celsius, which is within the normal range. So So now I'm going to disinfect the thermometer, then I use and place it back And after that, I'm going to perform the hand hygiene and document the data that I gathered and plot it on the patient TPR. So now I'm going to take the patient's body temperature through her axillary sites. Prior to conduct this procedure, I need to do the first introductory steps, which are to ensure my patient's privacy, provide comfort and do the hand hygiene. Then, I will introduce myself to the patient and explain what procedure I'm going to do. Hello, ma'am. My name is Kate and C. Aitona, your student nurse for today. So, ma'am, can I see your wristband? So, please state your name and your birthday, please.
My name is Mia Monica Peralta. My birthday is on June 15, 2003.
Okay, thank you. Okay, now I'm going to pull up your sleeve so I can put the thermometer. Now I'm going to use a different thermometer for my patient's body temperature through her axillary sites. Before I'm going to place the thermometer on her area, first I need to look at see if there are any scars or lesion and pat dry the area if it is wet or moist. Okay. So ma'am, please raise your hand for me. Thank you. Alright, now we're going to wait until thermometer beeps. So now we're going to wait 1 minute until the thermometer beeps, which indicates the patient's temperature is already obtained. After that, I have to inform the patient about the result of her temperature and disinfect the thermometer. Perform hand hygiene after that and document the data that I've gathered. Okay. So ma'am, your temperature is 36.4, which within the normal range. So now I'm going to disinfect the thermometer that I used and place it back. Then I'm going to perform a hand hygiene. It is important to know that axillary temperature is the 1 degree lower than the oral temperature. Then I'm going to document the data that I've gathered and in the patient's TPR sheet. So, okay, I'm going to proceed to take my patient's pulse rate. The pulse rate is the wave of blood created by the contraction of the left ventricle of the heart. In order for me to measure it, I'm going to need the palpation and the pulse sides of the patient, which could be through her temporal, carotid, apical, radial, and femoral tibial and her pedis. Today I'm going to palpating for her radial pulse because it is the easiest and the most accessible pulse size to provide the conduct of the procedure. I'm going to do first 4 pre-introductory steps which are close to the door to secure patient's privacy, I'm going to provide a indicate, lighting, and adjust the room temperature for patient comfort, and of course, perform hand hygiene. So, good afternoon, ma'am. I'm Kitty Yancy Aitona, your student nurse for today. Then, can I see your wristband? Okay, please state your name and your birthday, please.
My name is Mia Monica A. Peralta and my birthday is on June 15, 2003.
Okay, thank you very much, ma'am. So now I'm going to assess for your pulse rate. Can you give me your hand, ma'am? To locate the radial artery or the radial pulse, I'm going to use these two fingers of my hand, and I won't be using my thumb because the thumb actually has a pulse in it. I'll just have to trace her thumb and place my fingers in this area of her wrist and feel for the pulse, and it is important to know that aside of the beats per minute to count, I also need to check for the strength of her pulse, which is rated on 0 to 3 plus scale, 0 being the pulse is absent, plus 1 is if it's weak, 2 plus for normal, and 3 plus if it is bounding and curves. I also need to check for rhythm if it is regular or irregular. Now, okay. So now that I found her radial pulse, I'm going to start counting the beats per minute. I've now obtained my patient pulse rate. So ma'am, your pulse rate is 75 beats per minute. It is graded 2 plus, which is normal, and it has a regular rhythm. After doing the procedure, I can just simply proceed to taking her respiration rate without removing my fingers on her radial artery, and simply just look at the rise and fall to her chest so as not to make the patient conscious and dizzy, which can actually alter her breathing and give a much more accurate result for her respiration rate. Okay, ma'am, your hand please. Okay. So, okay ma'am, after doing the procedure, I'm going to do a hand hygiene and document the data that I have gathered in her TPR sheet. So now I'm going to measure for her fourth vital signs, which is the blood pressure. The blood pressure is the pressure of the circulating blood against the wall of the arteries, and it could be obtained with the use of a stethoscope and sphygmomanometer. Prior to the procedure, I must be the pre-introductory steps. Ensure patient security and privacy, provide comfort, and perform hand hygiene. And introduce myself and tell her what the procedure all about to the patient. So, good afternoon, ma'am. My name is Kita Yancy Aldana, your student nurse for today. So, ma'am, can I see your wristband? So, please state your name and your birthday, please.
My name is Mia Monica A. Peralta and my birthday is on June 15, 2003.
Okay, thank you. And I'll be taking your blood pressure today. May I see your hand and state your please. So prior to the conduct this procedure, I have already checked for my equipment if they are clean and that they are well functioning. I also have the correct size of the cuff that I needed for my patient, and of course inspected my patient if she has any injuries, cast, bandages, intravenous infusion, blood transfusion, or any arterial venous fistula, which could hinder me from taking her blood pressure, in particular limb. Ma'am, can you move from this side, please? Since the patient is sitting, and I'm going to make sure that both of her feet on the ground because the blood pressure increased if the legs are crossed. Okay, I'm going to place her arm at the heart level. Because if the arm is at the lower level, then it would give us the higher blood pressure reading, and if the arm is at the higher level, then the heart, it would give us low blood pressure reading. So since this initial examination of the patient, I'm going to do a preliminary palpatory determination of her systolic pressure to avoid having a lower systolic reading by auxiliary method if it's an auxiliary gap to do that. First, I'm going to place the top around her arm just about 1 to 2 centimeters above the antecubital space and palpate for her brachial artery through the use of my 2 fingers. Ma'am, I'm gonna So once I have found the brachial artery, I'm going to inflate the cuff until I no longer feel the pulse of her brachial artery. Now I'm going to deflate the cuff, and I've already taken her estimated systolic pressure, which is 110 of a mercury for actual taking her blood pressure. I'm going to inflate the cuff because about 30 millimeters of mercury higher than the estimated systolic. pressure. This is to ensure to avoid missing osculatory gap, which is the temporary disappearance of the corrupt sound while deflating the cuff. So, the actual procedure, I'm going to use my stethoscope, but first I'm going to disinfect the earpiece and diaphragm and the bell of my stethoscope. Now I'm going to use the bell part because the bell part is the best used for hearing the low pitch sound. Once I have found the brachial artery, I'm going to inflate the cuff until 140 mm of energy. Now I'm going to fully inflate the cuff. The first sound that I have heard would be her systolic pressure, and for the diastolic number, it would be the period of the silence after the last sound that I have heard. And so this is my patient's initial examination. I'm going to procedure again on her other arms. So ma'am, I got your blood pressure and it's 115 over 75 millimeters of mercury, and it's within the normal range. Thank you so much for the cooperation, ma'am. Okay. And I already have her blood blood pressure rather, and after doing that procedure, I'm going to fully deflate the cuff and wipe the cuff with disinfectant so that to reduce the risk of cross contamination. And of course, I'm going to do a hygiene and plug the data that I have gathered in my patient's TPR. Okay, ma'am. So I have gathered my patient's CPR sheet, and that would be all for my return demonstration of the obtaining vital signs. Thank you very much.